Welcome to Charge Passing training for physicians, mid-levels, and clinical staff. Before we start, I'm going to review some key points in regards to charge passing. The first extremely important point is that all charts must be pulled from the appointment schedule in EMR. If a provider attempts to sign off on the chart and it was not pulled from the appointment schedule, a yellow triangle and error message will appear in the sign-off window stating that this encounter cannot be billed electronically. If this happens, the provider must cancel out of the sign-off screen, go back to the appointment schedule, and double-click to pull the encounter from the schedule. The second point is in regards to documenting in the assessment and plan. All orders and procedures that you want to bill for must be ordered in the assessment and plan. All orders and CPT codes must reflect the actual provider or the ordered for provider on the order. The ordered for provider can be edited within each ordered code by right-clicking on the CPT code, selecting Edit, and changing the ordered for field so that it reflects the proper ordered for caregiver. This also may be defaulted to the appointment caregiver under caregiver customizations that we will review at a later time in the training. The final key point is that you must use valid diagnosis codes. All labs and procedures must be linked to a valid diagnosis code, and only system-delivered diagnosis codes should be used. If a SNOMED or a free text code was used, that code will pass to the PM system, but no diagnosis code will pass along with it. An error message will also appear during the sign-off. The billing status will need to be changed, or a different lab procedure with a valid diagnosis code will have to be chosen. For the next piece of the training, we will discuss the EMR user customizations. In order to update the customizations, under the actions on the right side of the screen, click on Menu, and then select Caregiver Options. The Caregiver Options allow the users to customize views and options in specific places throughout the EMR. These settings are only changed for your user login and not for all users. The first thing that we'll discuss is the Billing Level Quick List. The Billing Level Quick List can be customized to allow the most frequently used billing levels to appear at the top of the billing level drop-down in the sign-off window. All billing levels will appear below the dotted line. The default billing level cannot be changed. In order to customize the Billing Level Quick List, select Under Lists, Quick Lists. Under Lists at the top, click on the drop-down and select Billing Levels. All of the billing levels will appear on the left. To customize your Quick List, select the billing levels that you use frequently and move them to the right. These codes will then appear above the dotted line in the sign-off window under Billing Level. For the Encounter Type Quick List, click on the drop-down and select Encounter Types. You'll follow the same process that you would for the Billing Level Quick List. If you are a site nurse, you may want to select the Transition of Care so that shows up at the top of your list. For providers, the most common will most likely be office visit, so you may want that to appear at the top of the list. Select it and then click the blue arrow to move it to the right side of the screen. For the default encounter type, you'll click on the sign-off option under the General field, and this is where you can select your default encounter, the third box down. Under this one, I'm going to select Office Visit because that's the most common one that I would use. The default encounter type can be customized to allow the most frequently used encounter types to auto-populate in the sign-off window. All encounter types will be listed below the dotted line, as with the billing level and the encounter type. For the default ordered for caregiver, you'll click on the assessment and plan. At the bottom under General, you'll notice that there is an option for when placing medication lab and procedure orders, default the ordered for field to. At this time, we are recommending using the appointment caregiver because that is what would be the most commonly used option. You can also at this point set the default notify caregiver for labs and procedure orders. We also recommend that in these cases you would use the appointment caregiver. Other options can be set, but it's critical that if you choose one of the other options, such as preferred caregiver or a specific provider, that you check the ordered for and the notified provider on each individual order. Typically, using the appointment caregiver will flow through the proper information. Once you've completed making all of your changes, click OK, and then the changes will take effect.